Medicare can be stressful and hard to understand, so why not call the Healthcare Jedi to help? And here to explain some rules and new rules with healthcare agents and what you need to know is the Healthcare Ninja. Let me make sure I say it right. Healthcare Insurance Jedis. There we go. And it's Laura and Lee Draper here. How are you two doing?
Doing great,
Awesome.
Good to be here.
This is a time we know that open enrollment is almost, like less than a couple of weeks away, right?
Well, for Medicare, it technically started October 1st, but we can't enroll anybody on plans till the 15th.
Okay. And this is something that you're here to talk about that you guys are very much advocating about, and that is making sure people are getting the right health care, making sure they're on the right Medicare, but also the rules that need to be understood. Because that might be a little stressful, a little not understanding.
Yes.
And one we want to talk about is the disclaimer that needs to start being told to you, correct?
Yeah, right now, due to some of the things that happened last year during Medicare season, some of the TV commercials that were running created a lot of backlash, and there was a lot of complaints to Medicare. When those complaints started coming in, Medicare started saying, okay, we're going to have to do something about this. So now, whenever we have a phone conversation with a potential client or anyone that calls us, it has to be on a recorded line, and we have to read a disclaimer to them within 60 seconds of that call.
Yeah.
And then we just can go into normal conversation
with them.
Yep.
Laura, let's talk about some of the conversations that you're having with people as we know about getting ready to change or to be enrolled and everything. What's some of the things we should be looking out for and some of the new things that people should also be asking when they're doing these kind of talks?
Well, I know that a lot of the Medicare plans, they get competitive, and so they're offering more benefits out there, and there are things available. And then also it's just educating people, on what is out there and what their options are.
And that's something that the Jedis like to do to make sure going through things, because every plan is different for everybody, and that's one thing people need to understand. All because Mary next door got her Medicare plan this way doesn't mean it's the one for you, correct?
Oh, totally. Yeah, exactly. I mean, because everybody has different needs. Everybody has different health issues. There are chronic plans for people with chronic issues. There are low-income plans for folks that are, living on Medicare and Access both. And these plans are really going out there to really put a lot of benefits on the table for folks. It's just a matter of us doing a little bit of a fact-finding session with people when we sit down, and then finding the right plan from there.
Yeah, and that's why it's so important, Lord, to give the Jedis a call, because again, it's very stressful if you're not understanding some of the care that you need or some of the things going on. Because again, you get these calls from people too who are trying to scam, who try to say, oh, we're going to give you this whole thing. But my understanding that some of those calls you get, they don't even actually have the right insurance for our state at times because they are different places, right?
Right. Yeah, and it's so important because a lot of people, Medicare can be confusing, and we're here to help simplify that for the people and help make it a little bit easier, make sure that they have, the right plan for them, that has the right doctors, the right, that their medications are covered and all those kind of things.
Yeah. Lee, let's talk about a couple of quick tips here for people who are looking to, of course, give you a call, or not even just you guys, but anybody who they're trying to get a Medicare. They really need to look out for one thing. One thing we said before, and you'll get some other tips, but that was they can't tell you what plan you should get, correct?
No. They can't tell you what plan. That's why hopefully they're calling us.
Yeah.
The thing is there's every year. Throughout the year, there's tons of commercials for Medicare. You hear them from every carrier out there, especially the major national ones.
Yeah.
And then there's just some more generic commercials. Those phone numbers and everything, if you want to call them, go ahead, but that person on the other end of the line generally isn't there for your benefit, and they're not going to be an advocate for you when something goes wrong down the road.
Yeah.
When you call that number back for help because there's something wrong with the plan you signed up on, you're not going to get any help. That's where we're at. We want to be your local reps. We want to be there for you when you need the help.
Yeah, and I like that, and that's so important when we're doing this. Tell people where they can find out more about, of course, getting on the Medicare plans, but also about the Jedis right here.
Okay. Well, we have our website is MedicareJedis.com as well as HealthInsuranceJedis.com. Those are both our websites. And our email, my email is just Lee at HealthInsuranceJedi.com. And same thing for Laurie.
I like this. This is great. This is good. Just sitting and talking. Appreciate it. Thank you.
Yeah. Well, thank you, Brad.
So there you go. If you are, of course, again, getting ready for Medicare, please talk with somebody because it is very confusing and can be very stressful.